Hi everyone, my name is Tommy and today I'm going to be introducing my policy, Improving Care for the Elderly During COVID-19 Action Plan. We acknowledge the traditional custodians of country throughout Australia and recognize their continuing connection to land, waters and culture. We pay our respect to their elders past, present and emerging. Why is it an important issue right now? The issue is important right now as we continue to battle against new waves of COVID-19 in 2022. The COVID-19 cases within residential care facilities are still rising, causing a higher mortality rate amongst residents living in aged care homes. Additionally, with the surges of COVID-19 through the industry, staff shortages and overworking is becoming a large problem for both healthcare workers and residents. There's a need for emergency plans and strategies to reduce the negative impacts of COVID-19 on aged care community, especially the elderly residents. Evidence that suggests this is an important issue. According to the Department of Health and Aged Care, as of the 2nd of September 2022, there are currently 2,436 active COVID-19 cases within the 388 active outbreaks amongst residential care facilities across Australia. Additionally, a total of 134,242 shifts have been filled by workforce surge staff in residential aged care facilities with outbreak due to staff shortages. They provide support for 98 residential aged care homes. Additionally, 35 personnel from the Australian Defence Force have been deployed to 522 aged care facilities to provide support alongside other health and aged care workers. Furthermore, due to the shortage of staff and continuing quarantine isolations from COVID-19 outbreak, the level of care for residents have been negatively affected as the workers are stretched thin and exhausted. While there's support being provided during these active outbreaks in aged care homes, the federal government needs to make plans for fixing prolonged workforce shortfalls, preparation for future outbreaks, and adhere the recommendation that have been put forward by the Royal Commission into Care. I have a little video to explain further.
An aged care worker says she feels the sector is failing residents as COVID leads to severe staff shortages. 1 in 3 centres across the state is now battling an outbreak of the virus.
Mandy works in aged care, a job that leaves little time to care for herself.
We're all doing back-to-back shifts. We're all exhausted.
This is her first day off in 20 days, covering for staff who are sick with COVID.
You've got residents that are isolated in their rooms and they've been there 6 or 7 days with absolutely nothing to do. It's almost like everybody's too scared to put their hand up and say, we're failing. And we are failing.
Of Queensland's 500 facilities, 178 have an active COVID outbreak, with a total of 964 residents and 726 staff infected. Aged care facilities are better prepared this time around. 70% of residents have had a 4th booster and there's access to antiviral medication. But still, there's concern as we head towards the peak of this 3rd wave.
We're already hearing from aged care providers that we've got 10 to 15% of staff unavailable.
It could get as bad as January, when 30% of aged care staff were off sick.
What it means is that we're unable to provide the level of care that we would want to.
A program to use the Defence Force to fill staff shortages ends within weeks, despite climbing cases. Queensland Health can help if asked.
If you cannot maintain those ratios in a safe way, then someone's got to step in and manage and look after those residents.
The question is, who?
So it's on the recommendation that I've come up with. Introduce permanent relief workers to fill in for staff during short staff shifts. Having adequate technology to support residents with telehealth care professionals that cover mental health and physical needs of the elderly. So challenges when implementing this policy. Some challenges that arise when implementing care for the elderly during COVID-19 are staff shortages due to nurses in aged care homes becoming infected. In 2022, the aged care facility in Australia are facing around a shortage of 35,000 aged care workers. This is a big concern when there are not enough workers to meet the basic standard for care that are recommended by the Royal Commission. Furthermore, the aged care workforce has already been under significant pressure due to low pay, poor working condition, and reduced staff. However, COVID-19 has increased this pressure to an impossibly high amount. Another issue is that more staff and residents becoming sicker with the COVID-19 outbreak. Staffs are burned out and exhausted to their breaking point, causing them to leave the sectors and not returning. While the government have made commitments to increasing the quality of aged care by having registered nurse roster 24/7 in aged care homes and longer mandate care time, however, it is a difficult goal to achieve without staff to fill those shifts. Another challenge is the increasing high demand for aged care services due to older Australians living longer and with more complex chronic diseases, which requires more resources and treatments. Solutions to mitigate against or minimize these difficulties. According to the Australian Government Department of Health, the government have put in $600 million to support more than 265,000 aged care workers across 4 COVID-19 bonus payments. Furthermore, these payments are a recognition to their dedication and continuous support for vulnerable Australians. This provides an incentive that will encourage and retain aged care workers during time when they have to work above and beyond their already challenging jobs. Additionally, aged care services need to employ a larger workforce due to senior Australians living longer lives with more complex chronic conditions. To manage these complex conditions, the workforce need more specialized skills and knowledge to deliver the diverse care required for the elderly. Although many service providers have reported challenges with providing training and supervision for workers due to time and resource shortages, in order to deliver a diverse skill and value aged care workforce with the right knowledge to implement safe, high quality care for senior Australians, the government needs to promote approaches that will attract and maintain workers with the right skill and knowledge needed. Additionally, they need to deliver approaches that allow workers and providers the additional skill to achieve formal qualifications for their career progressions and applications of learning into practice and support aged care providers to develop sustainable and coordinated approaches to grow skilled workforce with delivering the right care needed for diverse community. Thank you for listening.